Hi, and welcome to our telehealth video information series. I'm Garvin, and this video is on Nearol. So what is Nearol used for? It's used for preventing organ or tissue rejection following kidney, liver, heart, lung, combined heart-lung, pancreas, bone marrow, or stem cell transplants. Treating transplant rejection in people previously receiving other immunosuppressants. It's also used for preventing and treatment of graft versus host disease, or GVHD, where the cells from transplanted bone marrow tissue attack the cells of the transplant recipient. Also, a syndrome caused by kidney inflammation characterized by a large amount of protein in the urine, swelling, weight gain, and high blood pressure. It's also used for severe atopic dermatitis or eczema, for which conventional treatments are ineffective or inappropriate, and also severe psoriasis, for which conventional treatment is ineffective or inappropriate, and severe rheumatoid arthritis, for which conventional disease-modifying anti-rheumatic drugs, or DMARDs, are ineffective or inappropriate, and sight-threatening inflammation of the middle part of the eye, called the uvea, including Behçet's uveitis. So how does Nearol work? Nearol capsules and oral solution contain the active ingredient cyclosporin, which is a type of a medicine called an immunosuppressant. It works by reducing the activity of the body's immune system. Cyclosporin reduces the activity of T and B lymphocytes, which are white blood cells responsible for regulating and triggering immune responses. Their usual role is to provide defense against infection and foreign cells. Cyclosporin prevents the T lymphocytes from producing substances called lymphokines. Lymphokines have many roles, including attracting and activating other immune cells and stimulating the production of antibodies by B lymphocytes. By stopping the T cells from producing lymphokines, cyclosporin prevents certain immune responses from occurring. If you have had an organ or bone marrow transplant, the donor cells, although matched as close as possible to yours, will not be identical to the cells in your body. As a result, your immune system will recognize that the new cells are different and try to attack and reject the transplant tissue. Cyclosporin prevents this by suppressing the activity of the cells in your immune system that would normally attack the transplanted tissue. If you have had a bone marrow transplant, the new blood cells produced by the new bone marrow can attack the cells of your body in a similar way because they recognize that your body cells are different. This is known as graft versus host disease. Cyclosporin controls the condition by suppressing the activity of the new blood cells. The skin conditions psoriasis and dermatitis are also affected by the immune system. It is thought that T cells overreact to a stimulus in these conditions, causing the scaling and inflammation of the skin. Cyclosporin can be used in severely disabling and resistant forms of these conditions to suppress the action of T cells and therefore improve the scaling of the skin. Rheumatoid arthritis, a syndrome involving the kidneys called nephrotic syndrome, and a type of eye inflammation called uveitis, are also treated with cyclosporin in certain cases. These conditions are thought to be caused by inappropriate activity of the immune system towards the body's own cells. T cells are involved in producing inflammation as part of their immune function. Suppressing their action can help to reduce the inflammation in joints seen in arthritis, the inflammation in the kidneys seen in the nephrotic syndrome, and the inflammation in the eyes in uveitis. So how do you take Nearol? The dose of Nearol that is needed will vary from person to person, depending on the condition being treated. It is important to follow the instructions given by your doctor regarding how much medicine to take and how often. The daily dose of Nearol is usually divided into two. These should always be taken at the same time, split evenly over the day, ideally at 12-hour intervals, so 8 in the morning and 8 in the evening. Nearol can be taken either with or without food, but you should always take it at the same time in relation to your meals. Nearol capsules should be swallowed whole with a drink of water, and Nearol oral solution doses should be measured using the syringe provided with the medicine. The measured dose should be pushed out of the syringe into the glass of liquid, water, or alternatively orange juice. Stir the mixture well with a spoon and drink it at once. Nearol oral solution should never be diluted with grapefruit juice. The measuring syringe for Nearol oral solution must not be allowed to come into contact with the liquid in the glass that you use to dilute your medicine. The measuring syringe must not be rinsed with water, alcohol, or any other liquid. If it is necessary to clean it, the outside only should be wiped with a dry tissue. You should not eat grapefruit or drink grapefruit juice in the hour before taking your dose of Nearol capsule or Nearol oral solution, as this can increase the amount of medicine that is absorbed into the bloodstream from your gut. If you forget to take a dose, take it as soon as you remember, unless it's nearly time for your next dose. In this case, leave out the missed dose and take your next dose as usual when it's due. Do not take a double dose to make up for near your missed dose, and keep taking this medicine regularly as prescribed until your doctor tells you to stop. Regarding pregnancy and breastfeeding, the safety of this medicine for use during pregnancy has not been established. It is not recommended for use in pregnancy unless considered essential by your doctor. So if you're pregnant and on Nearol, you need to speak to your doctor for further advice. This medicine passes into breast milk, as it could be harmful to a nursing infant. Women who need to take this medicine should not breastfeed. And next is the side effects of Nearol. So very common side effects: decreased kidney function, shaking usually of hands such as a tremor, headache, increasing the level of fats such as cholesterol in the blood, and high blood pressure, increased growth of facial and body hair. And common side effects would be loss of appetite, fever, fatigue, disturbances of the gut such as nausea, vomiting, diarrhea, peptic ulcer, swollen gums, flushing, and acne. So the side effects I've mentioned may not include all the side effects reported by the medicine's manufacturer. For more information about any other risks associated with this medicine, you need to read the information leaflet that comes with your medicine, or speak to your doctor or pharmacist for more. How can this medicine affect other medicines? So the immunosuppressant tacrolimus must not be taken in combination with this medicine. A number of medicines may decrease the level of cyclosporin in the blood and could make it less effective. Also, a number of medicines may reduce the absorption of cyclosporin from the gut. So for more on interactions, your doctor will need to review what medicines you're actually taking in order to decide the best course of action. That brings this telehealth video to an end. If you have any questions, you can leave them in the comments below or contact me through my website, mytelehealth.info, or call into us, Lynch's Pharmacy, Douglas, Cork, or you can ring on 021 436 6923 to find out more. Thank you for watching. Stay healthy and stay informed.